First of all, thanks for checking out this video. My name is Dr. Alyssa and I am the owner of Back and Step Physical Therapy. I wanted to come to you to talk a little bit more about trigger point dry needling. What is it? Why would you need it? And what does it do? So trigger point dry needling uses very small needles that are solid and very thin. So these are not like the needles that they use when they draw blood when you go to the doctor's office or when you go get a flu shot. In fact, 3 or 4 of these needles can actually fit inside the openings of those other types of needles that you may have encountered before. What they found is that by using these in certain areas and using particular techniques, it actually is kind of like pushing a reset button for those tissues. So it creates mechanical, chemical, and electrical changes. And they see changes in all kinds of different things related to our immune system response and pain response and all sorts of different things like that. So it's pretty neat to think about. We can use it on areas where maybe the muscles aren't working as hard as they should be to kind of try waking them up a little bit. Or if the muscles are overworking, we can use it to sort of calm it down. There are also other instances where we're not really looking at it from that perspective of treating the muscles, but also treating ligaments or tendons, a lot of different purposes for using dry needling. Typically what I find is different body parts feel different when you have them needled. Sometimes it can feel kind of twitchy or it can feel like a deep ache. It really just depends. And I try giving people a heads up of what it's going to feel like in those different areas that we're treating. And then afterwards, you typically have a type of muscle soreness, almost like you just had a hard workout of those same muscles. And I find that it follows a pretty similar pattern as when I do have a hard workout. If I normally get sore later that day or the next day, that's kind of what happens with needling. And then same thing, if it lasts about a day, that's kind of what needling does for me as well. Although it doesn't always last quite as long as if it were truly workout soreness. And then afterwards, we also treat it very much like workout soreness. Drink lots of water, continue with gentle motion, use things like hot baths or hot showers, different things like that, just for some of that self-care afterwards. And the important thing to know is we also don't use dry needling on its own. There are some cases for some patients who've been doing it for a long time where we might use it a little bit differently, but typically it's just a portion of what we're doing during the session, and then we're also doing some other hands-on treatments. We're following it up with exercises because it's a great time to sort of retrain your body and what it's supposed to be doing instead of just continuing in this pattern of how it's been functioning for a while. I've seen some really remarkable things come from dry needling, and they're always kind of fun stories to talk about. I remember somebody many years ago that I was treating, and he'd been working with some other therapists in a clinic that I was working at the time. And they were kind of getting to a point where they were running out of ideas of what to do for him. He was having horrible headaches all of the time, his balance was off, and things were just so messed up with this entire system that he had problems eating solid foods. And it wasn't because there was an actual digestion issue or chewing issue or anything like that. So we decided to try some dry needling, and I got a couple of spots up in his shoulders and just, wanted to see what that was going to do for him. And he came back in the next week. His balance was better. His headache was almost gone for the first time in a long time. And he actually had been able to eat half of a Chick-fil-A sandwich, which again, that was the first time he'd eaten any solid food for a really long time. So that was kind of neat. Definitely an extreme example, but still a cool one to talk about. And I've also had some success with folks, whether it's chronic muscle soreness. I have somebody that I work with on a regular basis for chronic pain who was on a lot of different medications and using a lot of different topical creams that were prescription, and having to figure out how to balance all of these different medications in a system in order to take care of his pain. And what we found is we're now at a point where if he comes in maybe about once a month or so, that actually works really well for him, and he needs to use minimal stuff at home to kind of tide him over until the next time, instead of being so dependent on all of these medications and over-the-counter creams and that kind of stuff. So it's neat to see what we're able to accomplish with it. It's something that I've definitely used on myself, or will go and get somebody to work on me just because I know what benefit it has for me as well. And so it's something that I like to recommend for some patients. It's definitely not right for everybody. There are circumstances where it is not appropriate. And it's by no means something that I use on every single patient or that we use on every single session. Sometimes it's, maybe one is just enough to kind of get you over the hump so that we can continue working on some things. And then on the rare occasion, I do have folks like my one guy that I mentioned who comes in about once a month for a treatment. So really, there are a ton of different options. It's a really cool modality or treatment option to have, and lots of different ways that we can apply it. And if you have any questions, just leave some questions in the comments below, or feel free to send me a direct message. Look forward to hearing from you guys. Have a great week.